Hello, welcome to Pharmacy Burner. In this video, we're going to cover general pharmacology, which include introduction and definition, pharmacokinetic and pharmacodynamic. So first, we're going to cover the introduction of pharmacology. Pharmacology is the science of drug. The word pharmacology derived from the Greek words pharmakon and logos. Pharmakon means drugs and logos means discourse in. Pharmacology mainly deals with the interaction of exogenously administered chemical molecules, which are mainly drugs, with living system. Oswald Smedberg is the person who known as the father of pharmacology. Next, we're going to cover some basic definitions. The first one is drug. Drug is any substance or product that is used or intended to be used to modify or explore the physiological system and pathological state for the benefit of recipients. Next is pharmacotherapeutics. Pharmacotherapeutics is the application of pharmacological information together with the knowledge of disease for prevention, mitigation, and cure of a disease. Next is clinical pharmacology. Clinical pharmacology is the scientific study of drugs in human volunteers. It includes pharmacodynamic, pharmacokinetic investigation in healthy volunteers as well as patients. So, clinical pharmacology can also called as clinical studies. Clinical studies has 4 phases: phase 1, phase 2, phase 3 and phase 4. These 4 phases we are going to study in upcoming videos. Next is chemotherapy. Chemotherapy is the treatment of systemic infection with specific drugs that have selective toxicity for the infecting organism. Next is toxicology. Toxicology is the study of poisonous effect of a drug and other chemicals for detection, prevention and treatment of poisoning. It also includes study of adverse effect of drugs. Next, we are going to cover pharmacokinetic in depth. Pharmacokinetic is the movement of drug through and out of body. We can also say what body does to drug. It includes 4 different processes: absorption, distribution, biotransformation, also called as metabolism, and excretion. The first one is drug absorption. Drug absorption is the process of movement of unchanged drug from site of administration to systemic circulation. Systemic circulation we call as bloodstream. Next is drug distribution. Drug distribution is defined as the reversible transfer of a drug between one compartment to another compartment. There are mainly 2 compartments: extracellular fluid and intracellular fluid. Next is biotransformation. Biotransformation of drug is defined as conversion of drug from one chemical form to another. Biotransformation, also known as metabolism. Most of the drugs are metabolized in liver of the body. Next is excretion. Excretion is defined as the irreversible loss of drug from the body. Most of the drugs are excreted from body by urination. There are other routes of excretion also present, which are through fecus, sweating and breastfeeding. These are also the routes of excretion of drugs. Next is elimination. Elimination is the process of removal of drugs from the body and termination of its action. Elimination is the combination of biotransformation and excretion. Next, we are going to cover pharmacodynamic. Pharmacodynamic include physiological and biochemical effect of drugs and their mechanism of action. We can also say what drug does to the body. It mainly includes mechanism of action and adverse effect of drug. Mechanism of action is the process through which a drug shows its action. There are many mechanisms of action through which a drug shows its action. Mainly through the enzyme, a drug can show its action. Through receptor, a drug can show its action, and some ion channels through which a drug can show its action. The cell presents many many kind of ion channels and receptor on its outer wall through which a drug can show its action. Next is adverse effect. Any undesirable or unintended action of drug is called as adverse effect. Any kind of drug or medicine have two kind of actions: desirable action as well as undesirable action. Desirable action is the action which we need to treat the disease, while the undesirable action is called as adverse effect. Thank you for watching Pharmacy Burner. Please like, share and subscribe.